Now let's move on to our new regular segment for Mondays, where we turn to a medical expert for more in-depth diagnosis on the current issues involving COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you again for joining us.
Thank you for having me.
So for more than the past month or so, the greater capital area in South Korea has been under the strictest social distancing measures at level 4. But new infections keep sprouting nationwide, which led to an extension and strengthening of these measures for another 2 weeks. Before we get into the details, Dr. Tan, what do you think is the main reason behind the continuing spread?
I think the main reason is that even though we knew the Delta variant had entered the country at the very beginning, there were no strict measures implemented right away. And so the Delta variant had already spread throughout the country before measures were increased to level 4. This is in contrast to other countries such as New Zealand that went into strict nationwide lockdown after only 30 or 50 patients with the Delta variant were discovered. And that's the kind of speed that's needed in order to get the Delta variant under control. As we all know, the Delta variant is much more transmissible. It does have vaccine escape properties. In other words, even people who are fully vaccinated can get infected with the Delta variant and can pass on the infection to others. And this variant causes very high viral loads from the very beginning of the infection. And so even if a person does not have symptoms, they can still pass on the virus to others. And that's what makes it so difficult to control.
Now, under the latest distancing rules that will take effect today, cafes and restaurants will have to close by 9 p.m., an hour earlier than before. And after 6 p.m., only 2 people can meet, but there can be up to 4 if the 2 are fully vaccinated. How do you assess the latest measures? How effective will they be in curbing the spread?
I think they will only be moderately effective. And the reason why I say this is if you look at where the active clusters are in Korea right now, actually none of them are from cafes and restaurants. They're from public baths, hagwons, churches, preschools, logistics centers, places of work. They're not happening in large numbers in cafes and restaurants. That being said, there may be a lot of underground spread occurring among young people in these kinds of venues, restaurants and cafes. And so I think that there will be some effectiveness, but I don't think it will be very dramatically effective.
Well, as we've mentioned, the latest measures will be in place for the next 2 weeks, but 2 weeks after that, in mid-September, South Korea celebrates the Chuseok holidays, or the Korean Thanksgiving. How much longer do you expect the highest distancing level to continue?
I would be shocked if the measures were eased before Chuseok. As you reported previously, officials around the world suspect that 80% of the population will need to get vaccinated in order to achieve herd immunity, with the Delta variant being the dominant strain. There is no way that Korea will achieve that number before the Chuseok holiday. So I suspect that the highest level 4 measures will be sustained throughout the Chuseok holiday. I think people should be aware of this and make arrangements now not to travel for Chuseok. And also just for the vaccination effort to really pick up speed so that we can try to get to 80% as soon as possible.
Dr. Tan, last time we briefly touched upon the possibility of moving towards an era where we would have to live with COVID-19. South Korea's health authorities kind of changed its previous stance and said they may consider drawing up the with corona plans in late September or October. Now, if the plan gets pushed through, if it could mean putting a stop to counting daily new infections and scrapping mass contact tracing and the resumption of large gatherings. What are your thoughts on this? Do you think it's too early for that?
In the last week, we've seen days where the number of deaths were in double digits. Just overnight, 13 more people passed away. And so I think end of September is probably too early to even think of a with corona or with COVID plan. Yes, eventually we will need to have a plan to live with this disease as an endemic disease, and that will include some form of surveillance that is not as invasive. Hopefully, we will have effective treatments, such as we have for Tamiflu, for influenza, that really cut down transmissibility as soon as you start taking the medication. And once we have sort of a societal acceptance of what kind of mortality rate is okay in Korea. We can't bring it down to zero, but what is an acceptable rate? What is an acceptable hospitalization rate? I think once society decides on these kinds of numbers, then we can think about a plan of easing measures and bringing this disease into one that, it becomes more like a flu, a seasonal flu situation, and no longer a pandemic kind of crisis situation.
So we could live with COVID-19, but late this year is too early. All right, it's time for us to wrap up our discussion this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Dr. Tan, thank you as always, for your wonderful insights again. We will see you again next week.
Thank you.